Hello everyone, I welcome you all to this channel, and this is the 10th episode of our video, which is Target Nursing Officer Exams. Question number 11. Which among the following is a true experimental research? Option A, factorial research. Option B, time series design. Option C, one-shot case design. Option D, one group pre-test, post-test design. Here, what is a factorial design? It is a type of experimental design in which at least two or more independent variables are involved. It is a experimental design, and this time series design, it is a subcategory of longitudinal research design. And one shot case, it involves only a single group of observation or group, and here there is no control group in one shot case design. And one group pre-test post-test design is a type of quasi experimental design. It is not a true experimental design. So the correct option here is option A, which is factorial design. Factorial design, it is a true experimental research design. Question number 2. The following are the first line drugs used in tuberculosis therapy except. So here we have to concentrate on this word except. So the given option is option A, isoniazid, option B, streptokinase, option C, rifampicin, option D, ethambutol. So we see here streptokinase. Streptokinase is not the anti-tubercular drug. It is a thrombolytic agent. So the correct option here is option B, which is streptokinase. Otherwise, all these three, isoniazid, rifampicin, ethambutol, are the drugs for tuberculosis. Question number 3. Which among the following is a cyanotic heart defect? Option A, transposition of great arteries. Option B, coarctation of aorta. Option C, aortic stenosis. Option D, patent ductus arteriosus. Here, congenital heart disease are divided into cyanotic and acyanotic heart disease. So in cyanotic heart disease, tetralogy of Fallot and this transposition of great arteries, and in acyanotic heart disease like ASD, VSD, then pulmonary stenosis, coarctation of aorta, then congestive heart failure, aortic stenosis, patent ductus arteriosus. These are the acyanotic heart disease, whereas this is the cyanotic heart disease. So the correct option here is option A, which is transposition of great arteries. Question number 4. Acetone breath or fruity odor in a patient is a clinical manifestation of option A, diabetic ketoacidosis, option B, hepatic encephalopathy, option C, lungs abscess, option D, poor oral hygiene. The correct option here is option A, which is diabetic ketoacidosis. In a patient who has diabetic ketoacidosis, they usually have this acetone breath or fruity odor breath. So the correct option here is option A. Question number 5. Which among the following is a major sign of distress during skin assessment of a newborn baby? Option A, Mongolian spot. Option B, milia. Option C, miliaria. Option D, scleroderma. The correct option here is option D, which is scleroderma. Scleroderma is the disorder of subcutaneous fats, and it is considered to be sign of distress in a newborn baby. So while assessing the newborn baby, if scleroderma is found, it is to be considered as the major sign of distress. Whereas Mongolian spots, they are the bluish, they are flat bluish coloration of the skin which appear at birth, And milia, they are like very tiny white and white in color, tiny white bomb in the skin, especially the face of the newborn. Miliaria, they are also called as heat rash. Miliaria occur due to blockage of the sweat ducts. Question number 6. Which of the following is a method of sterilization using dry heat? Option A, autoclave. Option B, hot air oven. Option C, inspection. Option D, pasteurization. The correct option here is option B, which is hot air oven. It is a method of sterilization using dry heat. Question number 7. A condition which is triggered by a reaction to medication or from a viral infection is option A, Plummer-Vinson syndrome, option B, Asperger syndrome, option C, Stevens-Johnson syndrome, option D, Tourette syndrome. The correct option here is option C, which is Stevens-Johnson syndrome. It is a condition that is triggered by reaction to medication or from a viral infection. And option A, Plummer-Vinson syndrome, it is a condition that occurs due to a long-term or chronic iron deficiency anemia. It is a condition that occurs due to occurs in people with long-term iron deficiency anemia. And option B, Asperger syndrome. It is a neurodevelopmental developmental disorders that is within the family of autism. And Tourette syndrome, it is also a neurodevelopmental disorder that is characterized by motor or vocal tics. Question number 8. The process by which new nurses are introduced to the organization are called option A, induction training, option B, in-service education, option C, continuing education, option D, deputation. The correct option here is option A, which is induction training or induction programs. Induction training or induction programs is the process by which new nurses or new employees or new recruits are introduced to the organization. In-service education can be simply defined as the relevant course or activities in which the serving employees or serving nurse can participate or can take part. And continuing education, it is a type of education that is provided to the adult who already left the formal education. Like suppose a nurse wants to continue her higher studies, she can leave that job like for 1, 2 or 3 years, and then after that she can come back to that same organization and serve that organization in the same post. That is called continuing education. And deputation is serving outside the cadre or outside the department. Suppose there is one nursing officer here, and there is a vacant post here for the post of ANS, and this is another hospital. And here is another hospital. So this nurse, she wants to apply for this post of ANS. So she can apply for this post as deputation. So she will get transferred to this post of ANS in the other hospital on deputation. Then after that deputation gets over, then she will come back to this hospital as the nursing officer. Question number 9. The first priority during the rehabilitation phase of burn care is option A, prevention of shock, option B, wound care and closure, option C, prevention of contractures, option D, prevention of respiratory distress. So here the question, we have to read the question carefully, because if we see only the first part of the question, here the first part says the first priority, but we have also to see the second part which says in the rehabilitation phase. So we have to concentrate on this phase also. So if in case if we concentrate only this one, we might choose the correct. We might choose the wrong answer in case of choosing the correct answer. So here the correct answer is option C, which is prevention of contracture in during the rehabilitation phase of burn care patient. The main priority is prevention of contracture, whereas this prevention of shock, prevention of respiratory distress is the priority when the patient first came to emergency. Wound care and closure of care comes in the after the patient gets admitted or during the care of the patient. So this option A and option D is in case of emergency scenario, and option B is when the patient is already admitted, and option C is during the rehabilitation phase of the burn patient. So during rehabilitation phase, the main priority will be prevention of contractures. Question number 10. The causative organism for whooping cough is option A, Bordetella pertussis, option D, Corynebacterium diphtheria, option C, Chlamydia psittaci, option D, Clostridium perfringens. The correct option here is option A, which is Bordetella pertussis causes whooping cough. Option B, Corynebacterium diphtheria causes diphtheria. And Chlamydia psittaci causes mild illness or can cause pneumonia also. It is the most common bacteria that infects birds. It is usually infect birds. And then Clostridium perfringens. It is the most common cause of food poisoning. Food poisoning.